I, Dr. Meghana, consultant obstetrician and gynecologist at AASRA Hospital, Bangalore. I've completed my MBBS from Adi Chunchanagiri Institute of Medical Sciences, Karnataka, and MS from one of the prestigious institutes of Karnataka, STM Medical College, Dharwad. I have a fellowship in minimal access surgery from World Laparoscopy Hospital. In the field of obstetrics, we take care from preconceptional care, pregnancy, delivery, and postpartum care. We promote epidural deliveries. As in layman term, it is painless deliveries. We deal with high-risk pregnancies too. In the field of gynecology, we take care from adolescent care to geriatric care. Coming to adolescent treatment includes treatment for PCOD, abnormal vaginal bleeding, irregular periods, obesity, hirsutism, acne-related issues. Robotics is a boon for modern gynecology. Robotics has made our surgeries easier. Accuracy of the surgery is 100%, and the suturing techniques is simpler when compared to laparoscopic surgeries. Thereby, the complications and morbidity to the patient is reduced, and as well as the injury to the vital organs such as bowel, bladder, and ureteric injuries are reduced. The patient can be discharged the next day after a robotic surgery. In the field of infertility, we do robotic surgeries for reanastomosis of tubal, that is tubal reanastomosis, and treatment of endometriosis, and in various other infertility procedures. Last week, we had a difficult case of hysterectomy operated robotically. The size of the uterus was 18 to 20 centimeter fibroid uterus. The patient recovered on the post-op day 0 and was discharged the next day. For precision care and accurate surgeries, we are here for you at AASRA.